Gelblum, neurologist from here in Miami, Florida, welcoming you on behalf of First Choice Neurology. And today's topic that I think is of considerable interest to all of us is the status of what happens when our loved one is in a long-term care facility. How do we as patients, how do we as doctors, how are we able to best coordinate the care of our loved one when they are in a long-term care facility? Now, as a neurologist, I can tell you we see lots of patients from long-term care facilities, patients with dementia disorders, people who have had strokes, folks with Parkinson's disease. So typically, in a non-coronavirus world, we would have many patients coming over to our office from a long-term care facility where they are best cared for because oftentimes the family can't take care of them. And we would see them in our office. Well, obviously that's not happening nowadays because long-term care facilities are basically in a state of lockdown. So it's very important that if you have a loved one, mom, dad, companion, in a long-term care facility, that you are equipped to ask the right questions about how best to make sure that your loved one is well taken care of. So let's go through a little bit of demographic background here. What's going on in the nursing home setting as relates to long-term care? Well, I can tell you long-term care right now is considered to be the major hotspot of coronavirus morbidity and mortality here in the U.S. And in fact, we know that at this point in time, 1/5, 20% of all deaths from coronavirus, from COVID-19, are occurring in the long-term care setting. So if we do a sample of the nursing homes in the United States, of 4,100 nursing homes, basically there have been 7,000 deaths. So a nursing home is an extremely sensitive area for anyone who is at risk of coronavirus. Now, let me explain. By definition, folks in a nursing home setting are at automatic increased risk for coronavirus. They tend to be over the age of 65. They tend to have other morbidities that are significant susceptible factors to coronavirus illness. So, for example, hypertension, diabetes, obesity, respiratory disease, immune compromise, history of cancer, debilitation, physical debilitation, stroke, Parkinson's. All of these present as increased risks for catching coronavirus. And then, of course, if you are in a long-term care facility, the proximity amongst residents in that facility makes it very easy for coronavirus to jump from one person to another. In fact, in Illinois, 40% of all coronavirus deaths occur in a nursing home setting. Same statistics are there for New York. And I want to remind you that these statistics by law are now public. In fact, it is obligatory since April 2020, for a nursing home to automatically report to the CDC and to CMS, Center for Medicare Services. They have to report the incidence of a resident or an employee who has tested positive for coronavirus. So this information is public. And rather than go online and look up at the CDC website, which can be somewhat difficult to navigate, you are by law entitled to know the prevalence of coronavirus within the nursing home setting of your concern. So if mom is at a specific facility, by law, you are entitled to know the number of residents and the number of employees who have tested positive. That is a statute that is now in place since April 20. So if you have any concerns about the nursing home where your loved one is in residence, please pick up the phone and say, listen, mom, dad is on floor 6. I want to know what is the prevalence of coronavirus in your facility, and I would like to have a breakdown in terms of patients and employees. That's very, very important information because as we know, coronavirus literally can whip through a long-term care facility, and the residents who are there are obviously extraordinarily vulnerable to die from coronavirus because of their age and the other medical comorbidities. So first point of today's discussion is to remind you all that nursing homes are basically ground zero for coronavirus death, and at least on a national basis, it's 20%. In certain states, such as Illinois, it can even approach 40%. So very, very important that if you have mom or dad in a long-term care facility, that you do everything possible to identify the epidemic status within that localized setting. So very, very important. So let's talk about, aside from asking the prevalence of the coronavirus within the population and the workforce, what are the typical questions that we should be asking our long-term care facilities as relates to the care of our loved one? It's not so easy to take care of a loved one with a chronic dementia or someone who's had a stroke or someone with multiple metabolic comorbidities. So, you know, we have to rely upon the nursing home to make sure that during this coronavirus pandemic that they are up to the task of taking care of our loved one, and by and large, most of them are. Obviously, we see some horror stories in the media about a nursing home in New Jersey where it just trampled through the bulk of the population, and we're aware of these horror stories. But clearly, as being a proactive child, as being a proactive friend, you can make sure that your loved one is appropriately managed during the coronavirus. And these are the typical questions. These are the questions that I believe need to be asked of every nursing home administrator or nurse in terms of who has interface with one of our loved ones. So what are the questions? First off, I would like to know who in your nursing home, either employee or resident, has tested positive. As I just said, since April 20, that is public information by law. They must report to the CDC, and they must report to CMS, Center for Medicare Services, if they have a resident or an employee who is tested positive. So very, very important to ask that simple question, because at that point you have more information about the prevalence of the coronavirus, the facility where mom or dad is residing. The second question that I always like to ask is, what is the nursing home doing to prevent infections? Are they isolating patients? Are they having dining rooms set up in such a way that there is the capacity for social distancing? All of this is imperative. So as a loved one, as a friend of someone who is in a nursing home setting, I think it's imperative that you ask, what are you doing in that facility to prevent infections? Not only is it a matter of hand washing and personal protective equipment provided to the staff, but what are the activities and what are the capacities of that nursing home to provide social distancing? Do they even have enough masks to give to the residents so that if someone is an asymptomatic carrier, that they would not transmit that disease to someone who is at that point uninfected? So, question one, I want to know the employees and the residents who have tested positive. Obviously, they're not going to give you names, but they have to at least give you statistical data within that setting, because that is lawful public information that must be reported. Number two, what is the nursing home doing to prevent infections? And again, these are simple telephone queries that can be provided to the nursing administrator, and they should be able to give you this information. Number three, does the nursing home staff have adequate personal protective equipment? People in the kitchen, the orderlies, people who are dispensing meds, are they masked? Are they gloved? Are they gowned? Because remember, in a long-term care facility, oftentimes patients are incontinent or maybe having an upper respiratory syndrome, whereby they may be having body fluids that are on the bed sheets or whatever. So we need to make sure that gowning, masks, and gloves are part of the personal protective equipment that is provided to the nursing home staff. And all of us have encountered shortages at the supermarket or the drugstore with regard to gloves and masks. In fact, in our office last week, we had a box of gloves that were set out on a counter for personal use of the employees and the staff, and the box walked out. So people are very, very concerned about their access to adequate personal protective equipment, and this is even more important in the long-term care facility, where they're not only dealing with the normal respiratory exhalations that you and I have under the best of circumstances that can transmit coronavirus. They may also be dealing with some bodily fluids, because lots of folks in a long-term care facility have accidents. They have urine accidents, they have bowel accidents, and we're not quite sure about the transmissibility of coronavirus in body fluids, but I can tell you it has been demonstrated in fecal matter. We don't believe it's in urine. So therefore, body fluids are considered to be a potential source of infection. So personal protective equipment in the long-term care facility, imperative. And remember, these facilities are locked down. So it's not as if you can just walk over to the long-term care setting and say, "Hi, Ma, I'm coming in for lunch." It's not going to happen. You can wave outside from the window, but to be actually able to go in and sit with your parent and have a meal, that's not happening right now. It happened before. Hopefully it'll happen after this coronavirus subsides, but it's not happening now. So therefore, it's very important that you have an idea as a surrogate for the care of your loved one, that they are able to provide the adequate supply of personal protective equipment. Now remember, this stuff is not cheap. So nursing homes oftentimes work under a narrow profit margin. So you want to make sure that they have the resources in place to provide personal protective equipment for their employees, for their workers who come in, the electrician that comes in to change the light bulb in Mom's room, and of course anybody who's making deliveries to the nursing home setting, or any engineer who comes in to change the vents, to change the filters and the air conditioning vents, etc. So personal protective equipment is imperative for anybody who's entering into the long-term care facility. Ask the nursing home what provisions they have. Very, very important, because this stuff is expensive, and obviously no one budgeted for any of this when they came up with their 2020 annual fiscal budget. So you want to make sure that the nursing home is adequately provisioned in terms of PPE, personal protective equipment. Number 4, what is the nursing home staff doing to connect your loved one with you and doctors like myself, who have to make sure that Parkinson's is well controlled, that Alzheimer medication is effective? What is the nursing home staff doing? Now, I can tell you, most residents in a nursing home setting are not accessing Facebook Live right now. Very few of them have their own smartphones. Even fewer of them have the opportunity to go on to Facebook Live or to do a televisit with Dr. Gelblum. They may not have the dexterity. They may not have the cognitive wherewithal. They may not even have a smartphone or any type of communicative device, access to a computer, access to a tablet, access to a phone that allows them to do a Zoom or a Facebook Live with you, or a televisit with me. So in my experience, what's been going on over the past few weeks is we would actually see the nursing home administrator or one of the nurses in charge of that patient use their cell phone or their tablet to assure that we can have the important televideo conferencing that we need to have in order to make sure that my patient is doing well, and in order for you to make sure that Mom is comfortable and happy and doing okay in that environment. So it's important to ask, in addition to the PPP, in addition to what you're doing to prevent infections at the nursing home level, in addition to knowing the number of employees and residents who have tested positive, in addition to making sure that you've got the adequate social distancing and provisions to assure a good protective distancing, that you say, look, I want to be able to Zoom with Mom on a Wednesday at 3 o'clock and a Friday at 3 o'clock and perhaps a Monday? Do you have the ability to make sure that that can be done? And it's also important for me as your doctor, Dr. Gelblum, the neurologist, to say, listen, I've got a scheduled televisit appointment with Mrs. Smith at Thursday at 3 o'clock p.m. to see how she's doing on her Alzheimer medication. Are you, Madam Nursing Home Administrator, going to be able to make sure that you will be there to facilitate that televisit encounter? So again, a critical question. What are you doing at the nursing home level to keep my loved one, my patient, your resident in contact with the outside world so that we can have some assessment that everything is okay? And I will say this, in the long-term care setting right now, stress levels are extremely high, and I've seen patients via televisit in the long-term care setting who are actually having worsened behavior, worsened cognition, worsened functionality. And why is that? Because they are isolated in many respects from their normal routine. They're not going to the dining room. They're not doing their exercises. They're not going to the group therapy, physical therapy classes. They're not doing their regular activities of daily living. They're in many respects extremely isolated. And whereas historically patients would go into the dining room, they'd go outside, they'd go get picked up by a loved one to go to a restaurant or a movie, that's not happening now. So as a consequence, many patients in the nursing home setting, from my experience, are having increased disorientation, increased behavioral outbursts, increased agitation. And this is something very, very important for us physicians to be aware of. So that's why now more than ever, it is imperative that patients are able to maintain good contact with their families and with their treating doctors because of the capacity for decompensation of that basic chronic illness in the nursing home setting. So telehealth, televisit, interface with family, now more important than ever in the long-term care facility, because we're not able to actually directly touch those patients to interface with them. And by virtue of the disruption of their daily cycle, there is a tendency to decompensate with regard to chronic illness. So now more than ever, loved ones need to make sure that the nursing home is televisit, telehealth enabling, and that the physicians that take care of those patients are telehealth advocates and able to interface with whomever they need on a telehealth basis. Also, it's very important that guardianship be adhered to with regard to residents in a long-term care facility. Because as a loved one, as a caregiver of a loved one, you're going to have to make the decisions with the nursing home administrator when you call and say, listen, my mom needs to have her follow-up neurologic appointment with Dr. Gelblum. This coming Thursday at 3 o'clock is scheduled. I can't pick her up to take her to that appointment. So what can you do to make sure that that televisit occurs as scheduled? And I can tell you the vast majority of televisits and telehealths that I've encountered, this goes on just fine. It's either the nurse by the patient or the administrator at the patient, and it goes on just fine. And now with the telehealth and televisit technology that we're all using, it's not difficult. So basically anybody with a smartphone can easily access the healthcare provider. So item 4, what is the nursing home staff doing to connect patients with family and doctors? Basically, it's got to be all about mobile interfacing and great lines of communication. So a question that you need to ask, and I can tell you this, this is not going to be our last bout with coronavirus. In fact, we've had coronaviruses on the planet for many, many years. This is COVID-19. We're going to see COVID-21 or COVID-23 or COVID-26. So this is all a wake-up call and a great exercise in preparedness for all of us. So if you do believe that at some point mom or dad an aunt may be a candidate for a long-term care facility. Again, these questions are just as applicable. Hello, what are you going to do to assure that in the event of a lockdown from a severe disease where my aunt is going to be most susceptible, what are you going to do to fulfill these criteria that we're discussing today? So item number 5, plan of contact. How does the long-term care facility interact with a loved one? Is it going to be by phone call? Is it going to be by email? And it's very important to establish this line of communication very quickly. So upon entry into a long-term care facility, this whole algorithm of communication needs to be established right from the get-go. So if there's an issue, a phone call needs to be placed or an email needs to be sent so that you can respond. And oftentimes I think emails may be preferable because you can copy your doctor, you can copy other family members to get a consensus as to the best approach to handle the issue. So plan of contact, that's item number 5. How is the nursing home going to make sure that issues regarding your loved one are instantly and effectively communicated to the people who can make decisions? And then the last question that we all have to ask ourselves, is there full staffing level at the nursing home? So in the best of times, full staffing is imperative, but these are not the best of times. They're not necessarily the worst of times, but they're certainly not the best of times. So if that nursing home required such and such staffing in the best of times, and if now nursing home employees are out sick, what are the fallback mechanisms in place at the nursing home to assure that all needs are being met? Everything from janitorial to food service to hygiene to custodial to transportation. What are the fallback mechanisms in place? We've already said that nursing homes now are encumbered with even greater costs. They are having to buy lots of personal protective equipment. People are being isolated, so the old days of the buffet, those are gone. It's all table service, this, that, and the other, or room service. And make no mistake, that causes a significant increase in the nursing home's cost of doing business. Well, now, if there are employees who are out and a nursing home has to rely upon locum tenens nursing or pay a premium for people to work time and a half overtime, it's very important that we are aware that the nursing home facility where our loved one resides is up to par in terms of providing adequate staffing. So we've covered a lot of information over these past few minutes. These are the seminal items that must be discussed at all times when taking care, when adhering to the needs of a loved one in a long-term care facility. Has anyone tested positive, including patient or employee? Again, public information. By law, you are entitled to have this information. You can check it out of your own accord on the CDC or the CMS website, but you shouldn't have to. The response should be a number that is provided to you on the telephone by whatever admin or nursing head that you're speaking to at the long-term care facility. What is the nursing home doing to prevent infections? That's item number 2. Everything from social distancing to providing personal protective equipment to employees and staff. Number 3, does the nursing home staff have adequate PPE? Because we've just discussed that this is an expense that has to come in as a separate line item that was never budgeted for in January. So we have to make sure that those things are in place. Number 4, what is the nursing home staff doing to make sure that mom or dad is connected appropriately with the rest of the family, as well as with their doctors? So if the nursing home staff says, well, none of our employees have cell phones, or they have to check them at the door, and Mrs. Smith doesn't know how to work an iPhone, and we're not really sure how we're going to do a televisit with the doctor or with you as the family, or I'll just telephone you and let you know that mom's doing okay. That doesn't fly. Everybody has a cell phone who is working in a nursing home. So it's very, very important that you say, look, my doctor needs to have a televisit with mom as scheduled for her monthly Alzheimer appointment, because I'm concerned now more than ever that because of the constraints of the lockdown, the disruption of the circadian rhythm, the isolation, the loneliness, the lack of normal physical interaction on both a visual, a touch, and an auditory basis, I'm concerned that mom needs to be followed more closely now more than ever. You got to make sure that the nursing home facility is equipped to provide you telehealth services. And it's as simple as standing next to the patient with a cell phone so that I can go in and see that patient on a telehealth basis. Number 5, plan of contact, phone or email. How will you let me know if my mother is getting sick and needs to be transferred to the hospital or monitored or whatever? Are we going to do phone? Are we going to do email? And in many respects, email is a documentation trail that is very, very important, and it enables you to share information with other family members and with other doctors. And then number 6, remember, nursing homes didn't budget for personal protective equipment, and they didn't necessarily budget for time and a half if they're short-staffed. And if they've got staff employees who are out sick with corona, because I told you coronavirus is ground zero in the nursing home setting, accounting for 20% of deaths, then clearly we want to make sure that the nursing home is up to par in terms of full staffing levels. Now let's talk about those patients that actually get sick. I'm going to spend the last few moments. What if something happens to mom? She develops the typical coronavirus symptoms of upper respiratory, cough, fever, etc., has to be taken to the hospital. What then? When do we get mom back to the nursing home setting? Well, typically, the hospital will not release that patient back to the long-term care facility unless that patient has had at least 5 days of no fever, is obviously able to function at their pre-illness baseline, and is able to then go back to the same level of assisted care. This is a very challenging moment for family members, because you may be saying, well, gee, I was just visiting my mom in the hospital, and now she's going back to isolation in the nursing home setting. It's imperative that at the time of discharge that you have a very frank discussion with the long-term care facility, saying, look, mom is afebrile, she's been through a hospitalization. We're all aware about the potential for relapse from the coronavirus. We don't think people can get coronavirus twice at this point in time, but there can be a significant relapse where patients may be developing some chronic pulmonary insufficiency, which can, of course, predispose to another infection such as pneumonia, etc. So prior to discharge, it is very, very important that a very comprehensive discussion be had with that long-term care facility, saying, all right, you're ready to receive mom again. Are you going to be able to manage the getting up and out of bed? Are you going to be able to manage the respiratory therapy that has to occur, advanced cycle breathing techniques, etc., to make sure that mom's lungs regain their functional baseline? So that's the discussion, again, that must be had in addition to these other 6 points that we've mentioned previously, if mom is going back into the nursing home after a hospitalized experience. So we've got lots of questions that we need to ask our long-term care facilities. These 6 questions that I told you are the starting points. Who's positive in the setting? What are you doing to prevent infections? Do you have adequate PPE? What is your staff doing to make sure that a loved one is connected appropriately with family and doctors? What's your plan of contact for me? And then are you up to full staffing levels that may actually require some post-hospitalization respiratory treatment to get the lungs back to where they should be? So these are the questions that we need to ask each and every day. In terms of visiting your loved one, what does that entail? Well, right now, no one's allowed into the long-term care facility. Honestly, I believe that we should stay away from long-term care facilities until we are proven antibody positive on the coronavirus exposure. And as I've discussed in my prior Facebook Lives, there's lots of COVID antibody tests out there. So far, the only ones that seem to be valuable are the ones provided by Abbott Labs or Roche. So if you need to go visit mom in the long-term care facility, or you need to transfer mom, and you're concerned about a prior coronavirus exposure, you want to test yourself to see if you've been exposed, then the two tests that make sense right now are the Abbott Labs antibody test and the Roche Labs antibody test. The other ones do not have the degree of sensitivity that would allow you to safely say, I'm exposed, I'm immune, I can now go pick up my mother and go out for a drive. So those are the questions that we have to ask ourselves. And these are very, very important questions. And remember, many of us are having to deal with these questions on a daily basis. But the first thing you always have to do is ask, because the information by law is available to you. So you are entitled to have the information, and that is statute as of April 20, 2020, and that's federal statute. So I appreciate everybody's participation today. I look forward to visiting again with you real soon. If you have any questions about the health of yourself or a loved one in a long-term care facility, my name is Dr. Jeff Gelblum, and I look forward to visiting with you on a telehealth encounter so that we can discuss your personal issues on a more personal and plan of action basis. So I thank you for your participation, and I look forward to seeing you again real soon, sending you all a social distance hug and an air kiss. Have a great afternoon, everybody.